First of all, I would like to ask you for your permission to use this video for educational purpose and on the internet.
Sure.
Thank you.
You're welcome.
Now tell me, what were your symptoms before the surgery?
I had pain through my hip and down the inside and the outside of my leg, and it only allowed me to walk basically at the most 2 city blocks,
Okay.
and maybe stand at the most for 5 minutes.
1 to 10, how bad was the pain?
It got so bad I had to
Stop.
whatever I
Okay.
was doing.
Yeah, very high.
Yeah.
How long did you have that pain?
Roughly between 3 and 4 years before I had surgery.
But it was getting worse.
It was progressively getting worse, and I knew
Yeah.
I had to have something done or I'd be an absolute...
Can you show me where the pain in the leg was?
It was down through my hip and on the top, and then also on the inside down here.
Okay, so
And it would vary.
Yes.
Sometimes one, sometimes both, sometimes one or the other.
Yeah.
Always through the hip though.
So about a month ago, just about a month ago, we did a surgery here. We did a L3-4 OLLIF. Actually, we did that surgery not in a hospital. We did it in a surgery center. Is that correct?
Yes.
And how long after the surgery did you go home?
Just a couple, 2 hours I believe.
Yeah. 2 hours after surgery, you did go home. And I have the record of the surgery here. This is a surgery that we did actually within 27 minutes. And our blood loss was 24 cc, which is less than an ounce, which is very little for this kind of surgery. But you told me that you have seen other surgeons for this problem. And before we go there, tell me, the pain that you had in your legs, how is it now?
I have none.
So when did that pain go away?
Well, when I got up,
When you woke
when
up?
I recovered,
Yeah.
and they put me with, I walked with a walker, and I walked, and I could tell it was gone.
That was gone. Is that
It
pain
was,
still
it was
gone?
immediate for me.
Yeah.
Immediate.
Is that pain still gone?
Still gone.
Excellent. Now, you saw a few surgeons who offered you open surgery.
Mhm.
What do you remember what they told you regarding the surgery and details of that?
Well, what I do remember is that the recovery was significantly longer, 2 to 3 days in the hospital.
Yes.
And then I really had no idea what it would be like after that.
Yes. Well, generally, the recovery can be significantly higher because in open surgery, we have to strip the muscle of the bone, cut lots of muscle, lots of bone, and that sort of adds to the healing time and recovery time. But so far, we are just actually just 1 month after this surgery, so the pain is gone. And you told me you took the narcotic that we prescribed you only for a few days. Tell me about it.
3 days, Wednesday, Thursday, and Friday.
And then after that,
And on Saturday, I did not take any. I just took Tylenol.
wow, that is pretty good. That is really, and you told me as well that you have been doing some activities, and sometimes you feel that maybe you're overdoing it. Can you explain it to me?
Well, I remember, I don't remember exactly when it was I walked first. It might have been about 2 weeks.
Okay.
Any distance, I walked roughly a quarter of a mile.
Mm-hmm.
I went down to our mailbox and got the mail and came back. And that went really well. So from there on, it wasn't more than just a few days. I was up to 3/4 of a mile and then a mile. And probably the end of week 3, I was getting up to 1.5 miles.
Mm-hmm.
And I just walked 2 miles
Excellent.
a couple days ago.
Well, that would be unimaginable after open surgery. You're pretty good, but obviously we have to take care of your back first now.
Right.
And just, I'm sure you will notice that certain activity does give you some aggravation, and you just have to listen to that. But yeah, as well, there was some other event you told me that aggravated. What are the activities that make the pain worse? This is good for other people to know.
Well,
Let them learn from your pain.
my grandson was in his high chair. He weighs, I suppose, I'm not sure, 25 to 30 pounds.
Okay.
And without thinking, I lifted him out of the high chair and set him on the floor.
Okay.
It didn't hurt. That one did not hurt, and I had no pain.
Okay.
But the pain that I did feel is when I opened the tailgate on our F-250 Ford pickup, and I held it as I lowered it, and I knew I had made a mistake.
Okay, so now when we look at that, it's always an element of bending, twisting, lifting that makes the pain worse. Now, there's different kind of activity, but all of them have this in common. They have some bending, twisting, or lifting. So overall, happy with the results so far?
Very.
Excellent. Now, Any other comment you wanted the people in your situation know or consider?
Well, for me, I was looking at pain progressively getting worse to the point where I probably would end up either sitting or in a wheelchair, versus a very concentrated, small time of pain that gets better and back to a pretty much normal life, I'm sure.
Excellent. Well, thank you so much for the interview.
You're welcome.